Is the secretin stimulation test accurate for PEI? Imagine trying to find out how well your pancreas is working without surgery or complicated tests. The secretin stimulation test is one way doctors check pancreatic function, especially for pancreatic exocrine insufficiency, or PEI. This condition happens when the pancreas doesn't produce enough digestive enzymes, leading to problems like malnutrition and digestion issues. The secretin stimulation test works by giving a hormone called secretin through enroman 4. Secretin stimulates the pancreas to release fluids rich in bicarbonate into the small intestine. During the test, doctors collect duodenal fluid from the first part of the small intestine, after secretin is administered. They measure the bicarbonate level in this fluid. If the bicarbonate level is below a certain threshold, usually less than 80 milliequivalents per liter, it suggests the pancreas isn't secreting enough, indicating possible PEI. This test is considered quite accurate for diagnosing pancreatic exocrine problems. Its sensitivity, or ability to correctly identify those with the disease, ranges from about 60% to 94%. Its specificity, or ability to correctly identify those without the disease, ranges from about 67% to 95%. This means it is quite reliable, especially for detecting early or chronic pancreatitis, which is a common cause of PEI. The test also has a high negative predictive value, meaning if the test is normal, there's a very high chance the person does not have PEI. However, the secretin stimulation test is not simple. It requires specialized equipment and trained personnel, and it involves collecting duodenal fluid through endoscopy or specialized tubes. Because of this, it is usually performed in specialized centers rather than in routine clinics. While it provides detailed information about ductal cell function, it does not directly measure enzyme output, which is also important in PEI. In everyday practice, doctors often use other tests that are less invasive, like measuring fecal elastase 1 or doing breath tests. These are easier to perform and more widely available, but they may be less sensitive, especially in early disease stages. In summary, the secretin stimulation test is a highly accurate tool for assessing pancreatic exocrine function and diagnosing PEI. It is especially useful in complex cases or when other tests are inconclusive. Still, because of its invasive nature and limited availability, it is usually reserved for specialized settings. For those concerned about pancreatic health or pancreatic cancer, this test can help clarify whether digestion issues are due to pancreatic problems. But always remember, diagnosis and treatment should be personalized and guided by healthcare professionals who consider all clinical factors.